The Ohio State University Wexner Medical Center has one of the top skull-base programs in the country. Skull-base surgery is basically surgery that involves any disease or tumor that involves the base of the skull, which in many cases also involves the orbit or the eye socket. All skull-base teams have a neurosurgeon and an ear, nose, and throat doctor that are involved, but not every skull-base team in the country has an orbital specialist that's dedicated to that skull-base team. I have the privilege of being the orbital specialist for the OSU skull-base team, and in that capacity I'm able to lend my expertise to a lot of those processes that can affect the orbit directly or the optic nerve, which is deeper back in the cranial cavity and can cause vision loss. And so in that way I can use my expertise as both an ophthalmologist and an orbital surgeon to produce the best outcomes possible for our patients. One example of the value that I can bring to the skull-base team is that sometimes there are tumors that are in the brain in what we call the middle cranial fossa that are right behind the eye socket. And normally, these tumors would be approached by a neurosurgeon by doing a craniotomy. That's where we make a large scalp incision, we remove a part of the skull, and then the neurosurgeons approach the tumor through that route. Here at Ohio State, though, we've had the opportunity on several occasions to actually, instead of doing a large craniotomy, we've been able to go through the eye socket because of how close it is to the back of the eye socket. I can make a small incision about this long through the eyelid, temporarily remove the bone in the back of the eye socket, and then the neurosurgeons can go through that approach and deal with that tumor instead of having to do a large craniotomy. And that can greatly decrease the risk to the patient and also provide them a better aesthetic result from the surgery. So one of the advantages of having oculoplastic surgery as a specialty at The Ohio State University is that we have the expertise to do orbital surgery in a safe manner, and we can pretty much remove just about any tumor that needs to be removed safely through what's known as an anterior approach, through the front of the eye. Sometimes, however, we need to take different approaches for certain types of tumors. Sometimes we go through the nose and go through the floor or the medial wall of the eye socket, the wall that's next to the nose. Sometimes, in rare cases, we have to actually get neurosurgery involved and do a craniotomy where we remove part of the skull in order to get to the orbit. The thing about Ohio State is that we have one of the top skull-based surgery teams in the country. And as a member, myself as a member of the skull-based team, I'm able to take advantage of their expertise in order to deal with some of those very complex cases.